color Doppler evaluation of erectile dysfunction, which is the penile ultrasound. The World Health Organization says that since health is a fundamental human right, so must sexual health also be a basic human right. For penile vascular diseases, Doppler scanning, which is the color Doppler scanning, is part of the diagnostic process in most services that study erectile dysfunction in males because it is relatively atraumatic and inexpensive. It helps to establish the cause so as to better choose appropriate treatment. However, there is now a tendency to consider that the trauma and expense of investigation is not warranted because of the introduction of sildenafil citrate, which is Viagra, which is increasingly used to treat all causes. So, if we look at the anatomy, the first thing which is important is aorta, then is the common iliac artery, internal iliac artery, the penile artery, cavernosal artery, internal pudendal artery, bulbourethral artery, and dorsal artery. Here you can see the common iliac artery. With this is the branch which is inferior gluteal artery, obturator artery. This is internal pudendal artery, inferior rectal arteries. The main genital anatomy. This is penis and testicles. Then we have the head of epididymis, the epididymis, spermatic cord, vas deferens, the urinary bladder. There are venous plexus. These are the testes, the epididymis, and vas deferens, the glass penis and body of the penis. If we get a cut section, which is a cross section of the penis, this is the dorsum, the corpus spongiosum, and the corpora cavernosa. These are two cavernosal arteries, deep dorsal vein and superficial dorsal vein. So these two veins are important, and then are the corpuscle arteries. The arterial supply to the penis is from the internal iliac circulation through the paired internal pudendal arteries, becoming the penile arteries. The venous drainage is mostly from a dorsal vein of the penis to the internal pudendal vein to return to the internal iliac veins. Here is the right dorsal artery. This is the right penile artery, the dorsal and bulbourethral artery. From the dorsal, there are the cavernosal arteries. The penile artery branches. The bulbourethral artery supplies the corpus spongiosum and urethra. So it supplies this area. Whereas the dorsal penile artery supplies the cavernosa, the corpora cavernosa. The paired dorsal artery supplies the skin and glass penis. The paired cavernosal arteries give small branches termed Alessian arterioles that progressively divide to form lacunae in each corpus cavernosum. The clinical aspects: regional pathology, erectile dysfunction in cases of impotence. Normal erection is a neurological phenomena. Somatosensory efferent from the penis excite centers in the hindbrain and spinal cord. So sympathetic and parasympathetic autonomic efferent nerves then induce a vascular response. There is smooth muscle relaxation of cavernous arterioles resulting in vasodilatation and increased arterial inflow relative to venous outflow. Distension of sinusoids causes mechanical compression of draining venules against the tunica albuginea, preventing venous outflow. Now, before we perform the Doppler study of penis, which is called penile ultrasound, we must know that what the doctor needs to know.